Vovis,
Yep.
and she's going to explain how the whole thing works.
Okay.
So go ahead.
So this is the cochlear implant that is placed underneath the skin. This is what the surgeon places. It has the magnet inside, the electronic package, and then the electrode array that has 22 electrode contacts. This is what actually goes into the cochlea and replaces the damaged hair cells in the inner ear. Without this, so the surgeon places this. I don't know if you want to see the picture on here. Okay, so you make an incision behind the ear. The surgeon's going to place this part underneath the skin on the skull and then drills through the temporal bone into the middle ear space, make an incision into the cochlea, and wind that electrode array into the cochlea. Normally, how we hear with a hearing aid or just normal hearing, sound happens out in the environment, it's picked up by the hearing aid, it's amplified, sent down the ear canal to the eardrum, to the middle ear bones, which move in and out of the cochlea and set up a reaction of sound that goes to the brain. With the implant, though, you need something to wear on the outside that looks like a hearing aid that's going to pick up sound and then make it into a digital signal that travels down the cable to the coil. The coil will be connected to the implant. They stay connected through a magnet on the outside and a magnet on the inside.
This is under his skin.
That's under his skin. His skin will be in the middle.
And then so that's under the skin. This connects on the outside.
Mm-hmm.
And does that go into behind his ear?
This will go behind his ear. Yep.
So it'll be attached like back here.
Yep, exactly.
And then it'll hand here, and it'll go back in this way.
That's right. And so then it's going to send the information to the internal implant, which based on what information is coming in, will stimulate different electrode contacts, and then that signal goes to the brain. Now it is different than how you've heard before. And so your brain has to get used to the new way that it sounds and has to start to make meaning from what it's hearing. It's almost like starting over with a brand new.
I didn't hear that.
Okay. It takes some time for your brain to get used to the way that the cochlear implant sounds.
So you have to wait to get used to it?
She said that the words will sound differently when you hear the words.
Yes.
With the new hearing device. Your words will sound different. It'll take a little bit of time for your brain to learn the new language of what it sounds like.
Mm-hmm.
Is that a fair statement?
Exactly.
Yeah.
Yeah. So the more that you can wear it, the more that you can wear the processor, and the more that you practice at home listening, the better that it sounds. So, do you want me to type anything? Type it out?
We'll listen to it again.
Okay.
So she says, the more you use it, the better you'll get, the better you'll hear.
Oh.
For sure.
It just takes practice, and it's going to take practice talking to people so that you learn what a word sounds like, because you'll hear things, but your brain will take a little bit of time to process it.
Oh, yeah.
Yep. Yeah. So that's how the cochlear implant works.
And we're going today pick out some colors.
We are. Mm-hmm. Yeah.
And other device.
Other accessories.
Okay, what would be the other accessories?
Mm-hmm. Okay, so did you talk about the surgery yet with Dr. Woodson? Do you have another appointment with her? Okay,
Yeah.
good.
Could you give it to us quickly again?
Mm-hmm, for sure. So your surgery is at the main campus, at the main hospital. It looks like it's on June 21st.
Mm-hmm.
Okay. Yeah.
21st.
So.
Main campus.
Yep. they'll call you the day before to tell you what time to get there.
Right,
Yep.
they call.
They'll call you. And then the surgery itself usually takes a few hours. So once you're under anesthesia, it's 2 to 3 hours that you're under. But you go home that day. After you've recovered, you go home.
Surgery 2 to 3 hours.
And you'll go home with like a big cup on your ear to keep pressure on that site.
Yeah.
And then they'll tell you when you can take it off, when you can shower. They'll give you everything that you can expect after. Most people don't have much pain. They just take Tylenol for their pain. And so that you shouldn't have to worry about too much. But you can be dizzy after the surgery, or you can have a lot of noises in your ears, like the tinnitus, and that's normal. That should subside, the dizziness and the ringing, within a few days of the surgery.
I didn't get that.
Okay. It's normal to be dizzy after
Normal for what?
dizzy, like dizzy.
Oh, for me to be dizzy.
Better. You guys are vaccinated.
Yes.
Yeah.
We're vaccinated.
Okay.
And he'll be able to listen to this again
Yes.
and watch it on his iPad
Good.
and hear everything.
Good. Is this better? I know the glare.
I think so.
Okay. So it's normal to be dizzy or to have noises in your ear after the surgery, but that goes away after a few days.
Yeah.
And usually people are back to themselves, like their normal routine within the week.
Okay.
Okay? After your surgery, you'll have appointments with Dr. Woodson to make sure that everything is healing well. And then you'll wait a month before you get this
Yeah.
part.
Yeah.
1 month before you get this.
Okay.
Okay?
Yeah.
Perfect. And you will have a hearing test before you get this, because you have good low pitch hearing, low frequency hearing. Your hearing in the lows is good.
Yeah.
And so it may be preserved after the surgery. And if it is, we'll want to use that hearing to help things sound more natural for you. And what that means is there will be a little part on the end that goes into your ear like your hearing aids and amplifies the sound in the lows, and the cochlear implant will take care of the high pitches.
So when we come on July 16th, pre-activation.
Yes, that's the hearing test.
Right.
That's at the main campus with Dr. Santiago,
Yeah. And then the 20th, or July 19th, that's when you'll activate it.
Exactly. So that's the activation when you get this part on the outside. So, let's see what. Okay, so we talked a little bit about the implant versus the processor. This is on the inside, this is on the outside.
What was the thing on the far right?
This is the device. It's the same as this, but there's nothing that goes in the ear and nothing worn behind the ear. It's all one piece. But you can't use the acoustic part if his hearing is good
Good.
with this.
So we'll use the middle one.
We'll use the middle one. If his hearing's not preserved, we can always swap it for that if that's something you'd prefer.
No, I think
Yeah.
we're good with the middle one.
Okay. And then That this is just the different styles. Behind the ear versus off the ear, just something one piece.
This is you.
This is the one we're going to get for you.
Yeah.
Okay? That way, if you have some hearing in the low pitches, we'll put something that goes down in your ear and amplifies the low frequencies.
Okay.
Okay.
Now, which
Yeah.
side? You're going to put it on the left side?
Left side.
This side.
Mm-hmm.
Yeah.
Because your understanding is poorer on the left
Yeah.
side. Okay. And it comes with rechargeable and disposable batteries. So batteries that you charge up every night, like your cell phone, or disposable batteries that you throw away in the garbage after a few days. For the most part, people use the rechargeable batteries and only use the disposable batteries if there's an emergency, like a power outage, or you're going away for the weekend and you don't want to take your charger.
All right.
Okay?
Yeah.
But they both come with it. You're going to get a huge backpack that's filled with supplies for your cochlear implant.
Yeah.
Can we
And-
order batteries if we need them?
You can.
Okay.
But Medicare covers 2 batteries every year
Okay.
as a covered benefit.
But the disposables.
The disposables you can always just buy at a drugstore.
Oh, perfect.
Yeah.
Thank you.
Yeah, you're welcome. Okay, so we have to pick a color. So there's white, beige, gray, brown, and black. No transparent.
I don't know.
I'm gonna stop for just a minute.
We have to choose 3 things for accessories. So one option would be the waterproof case for when you're swimming, anytime near the water. You want to be near the water without having to worry that it's going to get wet.
The other option would be if you get near the water, you just take it off and put
Yeah.
it somewhere.
Mm-hmm. Yeah.
Okay.
Yeah. It's water resistant, especially with the rechargeable batteries.
Okay.
It can be even submerged in water for up to like 3 feet for 30 minutes.
But if it was going to be raining or something, we'd get it off and.
Yeah, if it's raining, you just want to take it off, especially if you're caught in like a downpour.
Okay.
Then take it off. If
What
it's
about
just
taking a shower?
taking a shower,
Take it
you
off.
take it off. Going to sleep, you take it off.
The next one is the TV.
There's a TV streamer. So this directly, it connects through a wire to the TV, but then it sends the TV signal directly to your cochlear implant.
Yeah.
And then another option is this mini microphone. So the microphone is something that other people wear. So if you're driving in the car with
Yeah.
your wife, she wears the microphone and it picks up her voice and sends it directly to your cochlear implant. Or if you're at a restaurant, then the other person that you're with wears the microphone. Or say you're at a meeting or a lecture, you're going to hear someone speak about something, then they can wear it or they could set it at the podium so that you can hear them a little bit better. You can even use this just sitting it down on the table if you've got a big group of people. And it picks up their voices and just sends it directly to your implant. This is something that most people get. What kind of cell phone do you have right now?
iPhone.
iPhone? Okay. So you don't need this. This is a phone clip. It's for Android phones. But since you have an iPhone, the iPhone signal is going to go directly into the implant without any other accessory needed. So anytime that you're watching say like a movie or something on your phone or a phone call or listening to music from your phone, it directly streams into the processor.
iPad Pro?
iPad too. Yeah.
Oh, man.
Yeah. You just have to toggle in between, like it can't be connected to both.
So your iPad would go directly into his implant plant.
And the iPad, it would be a great thing to use for some of this listening practice that we just briefly touched on.
He is all over his iPad.
Good.
He's
Like
gonna-
if you're listening to TED Talks, like on your, if you go onto YouTube and do TED Talks,
Yeah.
a lot of those are captioned. You could have that, it would stream from your iPad to your processor, and then you could watch the captioning too, and that's going to help your brain start to recognize the speech. Yeah.
He'll fly through it.
Yeah. So another option is more rechargeable batteries. So you get 2 rechargeable batteries with your kit. That's just standard. And you're going to rotate through your batteries. So like one day you'll use one battery and the next day you use the other. And you go back and forth so that they each get used equally.
Yeah.
But if you wanted to have more rechargeable batteries, you could. So that's the other option. So you have to choose 3 things.
3 out of those 7?
3 things, yeah. And remember that the phone clip he doesn't need, so it's like 3 out of these.
6.
Yeah. It's
And
the
what are the-
water, we said the waterproof, the mini mic, the TV streamer, and the rechargeable of the 4.
Okay, you ready?
So after your surgery, then we wait 1 month before you come in for activation.
Yeah.
At the activation, we'll put the piece on your ear and we'll ask you to listen to different sounds, and you'll have to rate them to where they're comfortable. We want to set it for you so that it's comfortable, you can wear it all day long. And we'll test that out not just to beeps and sounds, but also to our voice. On that day, it's not going to sound like speech right away. When we talk to you, it might sound really distorted or like a cartoon character. Sometimes people even tell me that when I'm talking or their loved ones are talking, they just hear a beeping sound. But that's going to change as your brain gets used to the way that the cochlear implant is stimulating your auditory nerve. Then it starts to make sense of what you're hearing and recognize what's coming in as sounds and speech. So you'll notice that within the first week after the activation that you're going to start to pick up on things that you weren't hearing before. I want you to take like a log, write down what you're hearing, and I'll give you some things to do in the week before you see me again. So you'll see me for activation and then 1 week later. Your appointments might be a little bit longer because I think they fall at the end of July, which is when I'm on vacation. So it might be like a little, like a week and a half or something like
Must
that.
tap you for 1 minute.
Back to follow-up care. So you have your activation. We make sure everything is set so it's comfortable. It's not going to sound like speech right away, but it'll be comfortable for you to wear all day. And then you come back 1 week later to see me. And all we're going to do at that appointment is answer any questions, see how you're doing, and program the device again, because things will be different from that 1 week of use.
So let's look at this. So today, device selection, pre-anesthesia, pre-op. Then what's going to happen is on the 18th, we're going to get the COVID test. 20th, we're going to come and spend the night at the hotel. 21st, surgery to be determined. They're going to call us. It takes 2 to 3 hours. We know that 1 week after, we're going to do a post-op, and they're going to remove the sutures.
Good.
We know that he's possibly dizzy. We might hear noises in his ear that are unusual for the first week. Then that's July 1. That's our 1 week post-op suture removal. Then what happens is on July 16th, It will be 3 weeks post-op as we're going to meet with Caitlin Sukalak. And they are going to do what at this one?
Just clear you for activation. Make sure it's completely healed.
Okay.
Yep.
Then we come over to Santiago, and we'll do the pre-activation audio. What is that?
That's just a regular hearing test.
Okay.
But to see how much hearing's been preserved in the ear that was implanted.
That's right, because we think that there may be some lower level audio that he can hear.
Yeah.
And if that's the case, we'll use something that has...
It'll be attached to the end of this, and it'll look like the parts that go in his ear right now.
So it preserves the lower level audio. And that's on the pre-activation.
Yep.
And then on the 19th, which will be a Monday, we'll come and see you.
Yeah,
And you will activate him.
that's right.
And when you activate him, you're going to set it so that he can hear, and you want to get his levels, whether it's too high, too low, whatever.
We want it to be comfortable, and that's how he should leave, is that it's set comfortably.
Okay? And then we're going to come back a week
A
later,
little bit, yeah,
and that's going to be the 30th, 1 week post-activation.
exactly.
We're coming to see you, and we're going to do the same thing.
Right,
And then you're going to tune things up.
exactly. Answer any questions
And then we come back
at 1 month.
1 month post.
Yep. At the 1 month visit, I take you to the booth and test and see how you're hearing with the cochlear implant. And we compare that to how you were hearing with a hearing aid at your evaluation. And after that testing, then we come back here and do some more programming.
When you say programming, that's tweaking and adjusting things inside the processor.
Yes.
So the processor gets connected to the computer, and you might say, this is higher, this is lower, this is a comfortable level. He can understand, increase his lower level audios, decrease so-and-so, so that he has a better job understanding the words.
Yep. That's what I mean.
Okay?
And then at 3 months,
October
We-
12th.
do exactly the same thing that we did at the 1 month visit. But what you can see is we're just monitoring you during that first year to see how you're progressing, because we would expect that there are going to be big changes from 1 week to 1 month, from 1 month to 3 months. We're going to see improvements, and we would expect that, and we want to see it. And so if there are any red flags or any issues, then we catch them early. If you're doing well at your 3 month visit, we don't see you at 6 months. If you've made a lot of progress and you feel you're understanding well and the testing shows that, we don't see you. We only see you again at 1 year. It's 1 year from your activation. If at 3 months things are just, leveled out, or you're not improving as much as we'd expect, then we would maybe schedule something at 6 months to check in with you.
So
And in between here, you can come back whenever you need to.
log of hearing. You're going to finish up on that one.
Oh yeah, that just means I want you to write down what you're experiencing.
He's to log his hearing experiences from when to when?
From, I would say after every visit.
Okay.
He doesn't have to do it every day, but just occasionally jot it down.
And you also said that the iPod with closed caption,
Yeah, for TED Talks.
TED
Or
Talk,
if you listen to audiobooks, you can listen to audiobooks for practice with the cochlear implant.
okay,
You would read along with the book and listen to it from your iPad. But I will give you more specific exercises even at each appointment. I'll see how you're doing, and then I'll give you something to work on.
Good.
awesome.
Yeah. So
Have
that's what to expect within the first year. After that, you only come back to see me once a year. Or if you're having any trouble, then you schedule an appointment and you see me sooner. You can see me anytime.
Yeah.
Okay. So the last couple steps that we have for today's appointment, I'm going to go over some handouts in here. And then we're also going to do two things. Create an account for you with cochlear. That's going to help with registering your internal device at the time of surgery and external equipment. And then we're also going to set up an appointment with someone named Hannah White. She works for the cochlear implant company. And after your activation, we'll go over everything, but she'll also go over it again with you, like through a Zoom call, and answer any questions that you have about the equipment. She can help you pair things too.
So she will do it by Zoom, so we'll be home.
Yes.
And Hannah works for the company.
Hannah works for Cochlear, the company.
Okay.
Yeah. So we'll do that.
So she would work with cochlear.com.
Yes.
Okay. Perfect.
Do you have his cell phone with you?
No,
No, that's okay. You have your cell phone,
I do.
so we can scan this,
Okay.
and that will go to this link, and we can create an account for him.
Perfect.
Okay, my name is Nancy. I'm one of the nurses with Dr. Woodson here at the Cleveland Clinic. And I am going to go over the home-going instructions. The home-going instructions, so that you know what is normal after surgery and what we would want you to call us for, okay? It's going to be written down in your after visit summary, and the nurses will go over it again the day of surgery. So you might hear some of the same things,
Okay.
but that's what we want. We want you to be familiar with what's happening before you go into surgery. That's a busy day that day, and you might have some medication on board. So we like for you to review this before. So it's broken down into what to expect, and then again, this will be printed so everyone can see it, and when to call the doctor. So you're going to have an incision, but are you right, or is it the right or left ear? I don't know.
Left.
Okay. You're going to have like a C-shaped incision behind your ear.
Yeah.
Okay. Light bloody drainage out of that incision is very normal. Like a pink with clear kind of pinkish drainage out of the incision is very normal and nothing to worry about. We're going to talk about incision care a little bit farther. If you have bright red bleeding, either at the incision or out of the ear canal, we want you to call Dr. Woodson. I put her card in the front of the book that I gave you with the number to call. Okay. Mild dizziness after surgery, so feeling kind of woozy after because of all the surgery and the balance nerves are in your ear is very normal. But if you are having like severe vertigo, like severe dizziness, the room is spinning, you have to hold on to the table, you know, you're that dizzy, we would want you to call. Sometimes swelling in your ear can cause that, okay? And we might order some other medication for you to settle that down, if it even happens, okay? Do you understand that?
Yeah.
Okay, hearing loss, you might, I know you don't have a lot of hearing in that ear now, but it might get worse, a little worse with the surgery, and you might have more ringing in your ear after surgery, and it'll settle down, but that's normal too. That's nothing to worry about.
Okay.
The incision line, you're going to be doing some incision care with that, might feel numb, and you might feel like a little swelling back here. That's very normal. You're cutting through the nerves, and we're also putting an implant there, so it's going to feel like something's there. So that's nothing to worry about either. You might also experience a metallic taste in your mouth, like a metal, like a nickel kind of taste. There's 3 taste nerves, and one runs from the tip of the tongue through the ear. So when she does surgery, she could disturb that a little bit, and you might say, my gosh, I feel like there's metal in my mouth. That'll go away, and that's nothing to worry about.
Okay.
You are going to have pain. It's going to be painful, and she's probably going to order some narcotic today for a couple days. She'll order it today so that you can pick it up and have it ready. But you can easily transition to Tylenol and ibuprofen after the narcotic. But the reason I'm talking about that is if you're having pain and it's unrelieved by whatever pain medication she orders, we would want you to call, because sometimes that might be due to swelling also. And she might order like some steroid or something like that.
All right.
So reasons to call would be bright red blood, fever over 101.5, like a really stiff neck, or a really bad headache. Those 3 things are signs of infection. Fever, stiff neck, like not just a little bit like, man, my head is like pounding, okay? That we would want you to call. And then of course, if you had any kind of facial weakness or the side of your face looks a little bit droopy, because there's all kinds of nerves that run through your ear that she takes great care to avoid. But again, sometimes they might get a little bit swollen or inflamed or irritated, and then she might just order some steroids for that too. So when to call the doctor, again, is severe dizziness, blood out of the ear canal, bright red blood, stiff neck, headache, fever, increasing pain that's not going away with pain medication, and then facial weakness or drooping on that side of the surgery, okay? Now, you're gonna go home with a ear head dressing.
Yeah.
It's gonna look like,
She showed me a picture.
she did.
Yeah.
So it's a plastic,
Yeah.
kind of round, they call it a glass
Yeah.
cock. It has fluffy gauze inside, and then, okay, you'll go home with that to capture any kind of drainage, but you'll take that off the morning after surgery, and you'll start incision care, or your family, your wife will help you with that. Half peroxide, half water. You can mix it in a bowl, in a jar, in a cup, half peroxide, half water. Then take like a gauze or a tissue or a paper towel, you dab it, lightly clean off the incision. There might be some little drainage, that pink drainage we talked about.
Yeah.
Pat it dry, and then get an over-the-counter antibiotic, any kind of Neosporin or, bacitracin, whatever, wherever you go, CVS, Walgreens, and then either with a clean finger or a Q-tip, just put a small smear over the incision after you clean it. And you're going to do that twice a day. Clean it, pat it dry, put the antibiotic ointment. So if you don't have peroxide or fresh peroxide, sometimes we have stuff that's, and then the antibiotic ointment, pick that up between now and the surgery.
Leave it uncovered?
Leave it uncovered. Good question, yeah. Leave it uncovered. No dressing required after the first day.
Okay.
Okay? Now you're gonna have some, I don't know if you do any kind of aerobic
No.
activity? Do you walk basically?
He does.
Yeah.
So walking is very good. It's maybe for people that do more vigorous exercise. We say no running, jogging, bicycling, or anything like that. But we do encourage you to walk and move around. But no I guess we don't have to worry about that with you.
Okay.
No lifting more than 20 pounds. Blowing your nose really, really hard. Okay, so no, I don't know if you ever just take the Kleenex and really blow your nose.
Yeah.
No straining with a bowel movement for 4 weeks. So, actually I want to say for 2 weeks. For 2 weeks. So you don't want to do anything that's going to do some intra-ear pressure or intra-tympanic pressure. So that would be lifting. Do you lift anything more than 20 pounds?
No.
Probably not, yeah. So probably for you, do you have a tendency towards constipation? Or your bowel movements pretty normal? Are your bowel movements pretty normal?
Yeah.
You move your bowels pretty normally?
Yeah.
Okay. So if you had issues with constipation, we would encourage you to take some more stool softeners to avoid anything that's going to put pressure in the ear for 2 weeks. You don't wear a breathing machine at work at night? A CPAP?
No.
A breathing machine? Okay, that would be another no-no. Okay. You have a lot of appointments scheduled, right?
Mm-hmm.
So,
But this is our last one today.
like after the surgery, they're all
Mhm.
set up. So the first time you'll see us is 7 to 10 days after your surgery, and that's when they'll take out the sutures.
Yeah.
Check everything, do an audiogram, they'll do a pre-activation check, and then they'll activate, and then you have that series of appointments afterwards with the audiology department. So I hope you're hearing me pretty good. If not, it's all written there too. I want you to read it, okay? Perfect.
Go through that. So that's today.
Yep.
Then
This
go
is today.
Then go to the next page.
Perfect. Nice. So July 1st is your first
Right.
post-op appointment. And then you already have some dizzy and
No.
noises.
That's what she told us that it's possible that within the first couple days you may be dizzy, you may hear some noises
Right.
that are unusual. She said expect it. It's
Nothing to worry about.
Nothing
yeah.
to worry about.
Yeah.
Those are my notes on there
That's
from.
beautiful, yeah. Then Caitlin, she's here today. That's Dr. Woodson's physician assistant. And then
Yeah.
the pre-activation
It's
audio.
all scheduled.
Yes.
That's good.
Yes, everything's ready. Can you think of any questions about what I just went over about after surgery?
No.
Okay. And again, they'll go over this again if there's anything tweaked or anything that changes, but this is the typical
So I'm going to stop.